Hi guys, my name's Anna, and I will talk about how to address workplace violence and create a safer workplace. So in my presentation, I will define workplace violence, steps to survive workplace violence encounters, and finally strategies to address workplace violence at the policy level. Also, throughout the presentation, there will be some review questions which you can answer on the handout that I gave everyone in the class. So what is workplace violence? OSHA describes it as a verbal or physical act that occurs against a person while at work or in their occupational setting. So some social impacts, looking at the statistics here, in 2018, the rate of workplace homicides in the healthcare services was 4% of all workplace homicides. So fortunately, WV or workplace violence resulting in death is pretty rare. Another statistic to look at is that healthcare workers are 5 times more likely to be victims of WV than any other workers in any other field. So uh, that's unfortunately, we're at more risk than any other worker. So what are the assailant types? 3 types of assailants based on the relation to the victim are customer connection, employee history, and personal relation. And here's the first question on your handout. Which of the following is not an assailant type in relation to the victim? Customer, someone with criminal intent, coworker, or personal relation? Moving on into prevention and survival. So to effectively address workplace violence to create a more safe healthcare environment, it's super important to implement interventions at both the organizational and individual level. So workplace policies should be reviewed and signed by all staff. Typically, you want to discuss prohibited contact, reporting procedures, risk reduction measures, dangers and emergencies, at-risk employees, and enforcement. So how can we make a better workplace? Good ways to build a strong workplace means that we can have a clear, open discussion in the organization, providing chances for professional development, uh, and promoting a family-friendly environment, and so much more on top of that. Implementation of straightforward and easy to use reporting systems can help address these barriers, reduce the burden of reporting for healthcare staff, and prevent further burnout. So some de-escalation techniques, these are super important when it comes to workplace violence. Some of these steps include active listening. So this is making sure to understand what the person is saying rather than talking over them. Providing options, so giving the individual choices if they feel powerlessness. Avoid physical contact, so make sure not to touch them, and try to keep a fair distance away from them. Remove the audience, so take yourself out of the location or take anyone else in the room out of the location, and set clear boundaries. So this is to let the individual know that they have crossed the line. And then this is my second question. When escalating a potentially violent person, which action should you take? And then moving on to reporting violence. So at the organizational level, one should take steps to address barriers to reporting workplace violence incidents in order to better understand, address, and prevent problems. Violent incidents, when reported, reduce the risk of escalation. So with the use of cell phones and social media now, the warning signs provide a better opportunity for early intervention. Moving on to successful reporting. When thinking about reporting a WV incident, you should definitely consider preserving and submitting evidence which may include damaged property or written threat, obtain contact info of any witnesses who are involved, and prepare a report as objectively as possible. So some barriers that you might run into as a reporter. So this could be being afraid that you are overblowing the issue, not wanting to get anyone in trouble, fear of retaliation, not thinking anything will be done. I bet as social workers in our internship, we've come into this issue already. So at the organizational level, leaders should cultivate safer work environments by developing clear workplace violence protocols and taking steps to address issues such as staffing shortages and turnover. And then implementation of some interventions, I think that there should be more manager trainings, team building exercises, clear reporting systems, communication, empowerment, more trust among healthcare staff. This will create a safer work environment for patients and staff alike. And then the last question, which of the following is a barrier to the reporting of a workplace violence incident? One, not thinking anything will be done. Two, preserving and submitting evidence. Three, active listening. Or four, having an escape route. And then here are my references. Thank you.